Hey guys, welcome. It's Dr. Ray Heinisch, and today I'm going to be answering the question, should you take a statin drug? Perhaps you have a prescription in hand already. You've been recently diagnosed with high cholesterol, or maybe you have heart disease, or you know somebody who has a cholesterol problem or heart disease, and they've been told they need to take a statin drug. We're going to answer the question, what are the benefits, if any? What is the harm, if any, by taking a statin? All right, so that's today's topic. If you have family or friends who would benefit from this, please share this video with them now. Get them on, join the conversation, ask your questions, and hopefully by the end, you'll know exactly what you need to do. Okay, so that's what the topic is. Are statin drugs a scam? Okay, now, if you have a prescription in hand and you're hesitant to take it, most likely the reason is because you know that there are side effects. If there were no side effects to statin drugs, then of course we would take it because there is clearly some benefit. It's not a lot of benefit, as you're going to learn today, but if there were no side effects, who would care? The problem is there are a ton of side effects with statin drugs. Some of them can be very debilitating. So we're going to be talking about those today. First, let's talk about the most common ones. The most common side effects are, of course, muscle pain, muscle damage, muscle weakness or fatigue, liver damage. Those are the ones that practically everybody knows about. The ones that they don't typically know about is memory loss. This is something that can be very serious in some people, oftentimes causing them to feel like their mind is slipping. And they won't even realize that it's associated with the statin drug. In fact, there have been cases where people have literally developed amnesia from taking a statin drug. Luckily, those are rare cases, but there are cases where people have been seen standing outside their own home not knowing where they are because they started taking a statin. When they got off the statin, their memory and their brain function returned. Okay, so that's a potential side effect. Nerve pain, nerve damage, another side effect not commonly known about. Insomnia can be a problem with statin drugs. And some people who get started on a statin drug, all of a sudden they can't sleep at night. And they don't make the connection, and their doctor doesn't make the connection between the statin drug and insomnia. So those are all side effects that can be very debilitating. Sometimes people feel like they have arthritis, but in fact, it's a muscle pain or joint pain caused by the use of statin drugs. So there are very serious consequences to that. In fact, many of my patients who come in our office are scared to death to take a statin drug. And I believe for a right reason. Because, as I said, not only can you have negative consequences that ultimately make you feel bad, but they can be life-threatening in certain cases. Okay? So, the first question we need to ask is, do I really need a statin drug? Now, we live in a society where it's okay to die on medications. It's not okay to die off of medication. So, almost always, your doctor's going to tell you, take it or die. And in fact, I've had patients walk in the office who said, their cardiologist told them, if you don't take this drug, you are going to have a heart attack or a stroke. So the big question is that true? And that's what we're going to talk about today. Now, in order to get into this discussion, you have to understand just a very little bit about statistics. I'm not going to bore you with statistical numbers or anything like that. I'm not going to give you a full course on statistics here. Just two very, very important numbers to know. In fact, these may be the two most important numbers to know about any drug or any treatment that you choose. Okay? First one is called NNT, stands for number needed to treat. So what this number tells us is how many people do we have to give the drug to for a specific period of time to see some sort of benefit. Now, with statin drugs, the benefit we're looking for is to prevent one heart attack or prevent one stroke or to prolong somebody's life, prevent a premature death. Okay, so those are the three big numbers that we're looking for when we're looking at statin drugs. So we're looking for some sort of benefit, all right, from the medication. And how many people need to take the drug in the statin case for 5 years, let's say, in order to prevent one heart attack, one stroke, or one death. Now, in order to put this number into perspective, we also have to go to the next number, which is NNH, or number needed to harm. So this answers the question, how many people need to take the drug before somebody is harmed by the medication, whether it be some sort of side effect like muscle pain, weakness, liver damage, muscle damage, or, in some cases, how many people take the drug before they ultimately develop a serious condition that leads to death. With statins, we're looking at risk of muscle pain, weakness, liver damage, memory loss. We're looking at risk of diabetes, which goes up with the use of statin drugs. And so we'll talk about those as well. I'm going to give you those numbers here in the next slide. Okay? So we need to know number needed to treat, and we need to know number needed to harm, to weigh the pluses and the minuses. All right, so let's get into the number needed to treat. Now, in order to understand these numbers, you have to ask yourself, do you have heart disease? Do we know that you have heart disease? Or do we just see an elevated cholesterol and we're wondering whether or not to treat that elevated cholesterol? Because the numbers are very different. If you have heart disease, if we know you have plaque buildup in the arteries, or you've had a heart attack, or you've had a stroke, you have heart disease, these numbers apply to you. For every 83 people who take a statin drug, we prevent 1 death, okay? So that means 82 out of 83 people who take a statin drug gain no benefit from using that statin drug. 82 out of 83. For non-fatal heart attacks, you got to treat 39 people for 5 years in order to prevent 1 non-fatal heart attack. And that's basically what it sounds like. Somebody who has a heart attack, but they survive the ordeal. So 39 people, 5 years of statin drug will prevent 1 non-fatal heart attack. It means 38 out of 39 people who take the drug will not get the benefit of preventing that 1 non-fatal heart attack. Stroke, 120 people need to take the drug for 5 years in order to prevent 1 stroke from occurring. All right? So the question is this significant enough for you? And we're going to talk about that in a second. But first, let's go to people who do not have heart disease. What kinds of benefits can you expect in taking a statin drug? So here it is, the numbers. You save nobody when you give them a statin drug. Not a single person who takes the drug will live longer if they don't already have heart disease. Okay? That's an important number because the only reason to take a statin is to prolong your life. If you don't have diagnosed heart disease, you don't fall into the group for which the benefits outweigh the risks associated with statins. Okay? So you don't save a single life in people who do not have heart disease. You prevent 1 non-fatal heart attack in 104 people who take the drug, okay, for 5 years. So 103 out of 104 people who do not have heart disease who take a statin will not get a benefit. With stroke, you got to treat 154 people to prevent 1 stroke. Again, not that significant. So the question is, what about harm? 1 in 50 people who take a statin for 5 years will develop diabetes because they're taking the statin drug. That's very important to note. The drug itself causes issues within the body that set you up for insulin resistance and diabetes. So 1 in 50 people will develop diabetes because of the medication. 1 in 10 will develop muscle damage, and that can be pain, it can be fatigue, it can be very serious. And so that's also important to take into account. We don't even cover the risk of memory loss, neuropathy, or anything else. Only these 2 things are what we know the numbers for NNT as far as statins are concerned, okay? So it's important to note that. So the question is, if it's not that significant, why do very intelligent physicians still prescribe these medications? And I honestly believe that doctors have their heart in the right place, that physicians want to help people. The problem is the bias is so thick in medicine that once a prescription is given the FDA's approval, there's no need to continue to prove its benefit. And so the reason that they still prescribe statin drugs, even though the results, the benefits are fairly dismal, is because they are using what's called statistical medicine, or they're treating statistical medicine, meaning that they're treating the masses. They're not treating you. So if we give a statin drug to 1 million people, 45,000 of them, 45,000 will gain some benefit. And so medicine says, well, all we need to do is just give it to everybody. And if we give it to everybody, then we'll save this number of people, or we'll improve the outcomes for this number of people. That 45,000 could be preventing some deaths. It could be preventing some heart attacks, some strokes, okay? So that's very important to note, because when you're treating the masses, it means that they're not treating you specifically. And that's why I say you won't flip the coin enough to see the benefit. What that means is this. The chances of landing on heads if you flip a coin is what? It's 50-50, right? Does that mean that every time we flip a coin 10 times, we're going to land heads 5 times and tails 5 times? The answer is no. Sometimes you may land on head twice and tails 8 times, or vice versa. Or you might not land on heads at all. It might be 10 tails. Or you could do 4 and 6, or 3 and 7. The point is, in order to get to that statistical number of 50-50, you've got to flip the coin thousands of times. Each time you flip it, the closer you'll get to that 50-50 mark. Okay? I hope that makes sense. I know it's a little bit confusing, but it's the difference between treating one person and treating a million people. You won't flip the coin. If you take a statin drug, you won't flip the coin enough to be one who falls in that group who's likely to benefit. Okay? Very important to note. So where did we go wrong with statin drugs? Statins lower cholesterol. There's no doubt about that. They lower cholesterol better than anything else, whether it be natural. There are some new drugs that are available now that are very, very expensive, injectable forms that lower the cholesterol numbers better than statin drugs. But for the most part, statins lower the cholesterol best. The problem is statins are the right solution for the wrong problem. Elevated cholesterol is falling out of favor even in conventional medicine. The powers that be are now saying you don't take a statin to lower cholesterol or to reach a certain cholesterol goal now. It's the benefit comes from taking the statin itself. Probably because statins have been shown to decrease inflammation in the arteries. And that may be why you get that small benefit to longevity in people who have heart disease, right? But again, it comes down to the fact that elevated cholesterol is not the cause of heart disease. It's not irrelevant to the discussion, but it is not the primary cause. One simple way to demonstrate that is the fact that half the people, 50% of the people who are wheeled into the emergency room with a heart disease, with a heart attack, have normal cholesterol and have had their entire lives. Okay? So there is something else that is causing or responsible for them ultimately having a heart attack. It's not cholesterol, guys. There are many other factors that come into play, many daggers to the heart that are more important than how high or low your cholesterol is. Plus, this whole concept, do no harm first. Statin benefits are so small, and the bias in medicine so big, and in fact, practically all of these studies that have been published on statins have been funded by the very companies that ultimately sell the product. Now, I don't necessarily believe that there's a bunch of guys in white coats smoking cigars in a room somewhere saying, how can we screw over the American public and give them a drug that doesn't work? I just think the bias is so thick in medicine that the result is the same as if that were true. And with statins, because we know there is harm and significant harm, then that comes into play and that causes a lot of damage to our society. Okay? There are 2 types of harm, by the way, that statins cause. The first type is the one we've already talked about, all of the known side effects associated with statins. The second one is the fact that statins give an excuse not to do the things that can actually make a difference, right? So if we're taking a statin to lower our cholesterol and lower our risk of heart disease, then we're probably not going to do the other things that are a little bit more difficult that probably have a much higher likelihood of benefiting the body. For example, the Mediterranean diet. Oftentimes, people take statin drugs and they don't do things like eat well or exercise, things that have been clearly shown to benefit better than the statins. Let's take a look at some of the NNTs, the number needed to treat for the Mediterranean diet. Well-researched diet, not ideal. There are certainly ways to improve upon the Mediterranean diet, but at least we can see the numbers of benefit. The number of people that we need to treat with the Mediterranean diet to gain a benefit. We prevent 1 death in 30 people who consume a Mediterranean style diet. 1 in 30. Much better than people who are taking a statin. 1 non-fatal heart attack is prevented. That is prevented in 18 people. Okay? That, again, better than we get with a statin drug. So the problem is if people take a statin and because they're taking the statin, they decide not to do these other things, This is far better. And guess what? There's no NNH with Mediterranean diet. There's no number needed to harm. There's no side effects, negative side effects from consuming a Mediterranean diet or getting on an exercise program, which has also clearly been shown to be better for the heart than taking a statin drug. Okay? These are things that make meaningful impact. All right, let's review. Statins help very few people. Does it decrease risk of death in people who already have heart disease? Yes. By about the same amount as if you were to get out of the ocean's level would drop, right? It is statistically significant, but it's not meaningful to you because you won't flip the coin enough to see that benefit. Statin drugs cause significant harm, which is the major issue. Two types of harm: the side effects that you feel that can be debilitating for people and can end people's lives in certain cases, and the fact that it prevents people from looking for other things like the Mediterranean diet, like exercise, and by the way, certain supplements that can also improve things like omega-3 fatty acids, for example, whole food concentrates, multivitamins, vitamin C, things like that. There are other options with more benefit and less harm, okay? So that is the core message here. Should you take a statin? You know, I'm a pharmacist, so I understand that there are benefits to conventional medicine. I'm not like a lot of alternative medicine practitioners who just shun all conventional medicine and say you should do everything natural. I don't believe that's the case. If statins caused benefit, significant benefit to people, I would tell you that you should be taking a statin. The problem is, and it used to be, I would say, okay, well, maybe there's a place for statin drugs in people who have heart disease. But now I don't think that. In fact, I think that we should avoid statins. I think they give practically no benefit. And in the near future, I'll be reporting on some research that suggests it prevents us from forming necessary stem cells that ultimately prevent aging. So statins may actually age us at a more rapid rate. And that's something we'll talk about in the future as well. Okay? If you found that this was helpful, please share. Go to Wake Up Healthy. Look for the Wake Up Healthy Facebook page. Like that page. It's a brand new page. Also, check us out at wakeuphealthy.com. Sign up for our newsletter there, and I'll let you know whenever we go live with these types of videos again. And share it with your friends. Share it with your family. Anybody who can be helped by this. If you're in the Maryland, Virginia, D.C. area, also check out Wake Up Healthy, the radio show. It's on every Sunday from 10 a.m. to 11 a.m. on WCBM 680 a.m. Wake Up Healthy is a website that's devoted to bringing you cutting-edge anti-aging medicine information. So check it out, wakeuphealthy.com, and leave your comments, leave your questions, and I'll try to get to answering all of them after I'm done with this video. Thank you guys very much for tuning in, and I'll see you next time here on Facebook Live.